Our heart health is an important part of our overall well-being, and during the pandemic, it is especially important to take care of ourselves. Joining us now, cardiologist and medical researcher Dr. Ernst von Schwarz. Thank you so much for this. It has been a long pandemic year. Lives have completely changed. What has that change to our lifestyle done to our heart health?
A lot, and not good things, John. Keep in mind that the lockdown fatigue, the depression and everything which is involved in that has caused, for example, a lot of weight gain. So due to some polls and studies, at least 61% of Americans gained weight, and the average weight gain is between 3 and 15 pounds within the last year during the pandemic. So as cardiologists, we are very concerned about that because weight gain, obesity in particular, is considered a risk factor for heart health.
You know, not only are we gaining weight, but we've been living sedentary lives, or more sedentary. A lot of people are working from home. So, you know, even that exercise up and down a flight of stairs at your office is no more. Has that kind of come into play here?
Absolutely. I mean, we are concerned of what all this leads to, and that is basically our blood vessels become somewhat stiff. We call this endothelial dysfunction, and that leads subsequently then to plaque development within the arteries in the heart and the brain and all organ systems. So in order to overcome that, this is the time now. We have to start now, if we haven't done it already, to go back to an exercise regime. And of course, the gyms are partly still closed, so our recommendation is to do what we call any kind of high-intensity interval training. And you can do that at home. You don't need gym equipment. You can do that theoretically at all ages. And what you want to do is basically you want to bring your heart rate up in order to keep your blood vessels elastic and for your cardiac health and cardiac protection. And there's different ways to do that.
How do you do that? If you're unfamiliar with exercise, you don't do it often, what should you be doing at home to try to help your heart get healthy again?
So it doesn't matter what kind of exercise you do, but you have to keep two things in mind. Number one is you should basically stretch, move, and hold. And number two is you should do whatever you do at a high intensity for short periods of time. Let's say you go upstairs in your home. You can do that one time at a slow pace. I mean, that's good movement, but it really is not doing much for your heart. What you want to do is you want to push it. You want to push it to the point where you get really short of breath. You want to get your basic heart rate up to 85% of what we call your target or maximal heart rate, which is defined usually as 220 minus your age. So for a short period of time of 30 seconds to 1 minute, push so hard that your heart rate goes up to that percentage, and then follow this by a resting phase of approximately 3 to 5 minutes. Then do it again. So you can do it with stretching exercises, you can do it with squats, you can do it with push-ups, you can do it going upstairs. We have some videos how to do it and some examples what the best exercises are. Whatever it is, you have to push.
We have to commit to it in 2021. Let's commit to getting healthy after a year of pandemic. Dr. Ernst von Schwarz, thank you for this morning.